Marianne, coming to you first. We know our Connected Care strategy brings huge opportunity to improve customer outcomes and control costs. What are we focusing on when we are designing experiences to help manage customer outcomes and costs?
So the key principles I would say that we focus on when it comes to transforming that experience are having an end-to-end experience. It's really important that the customer feels that they're going through that treatment and that they have that end-to-end journey. They know where they're going. There's really clear signposting. We know we've got a lot of customer effort as well when it comes to that experience. So whether it's you're trying to find out about what you're eligible for, there's a lot of effort there that we want to be able to reduce as well. And we want to provide choice and guidance, right? We know that we've got some really great outcomes with Bupa provision. So being able to provide that guidance is also really important for that customer experience. And when we're going through that experience, something that we know customers have said to us is we need to be able to take the information that they told us at the start, so it could be through a digital GP appointment, and have that information throughout the journey so they don't have to repeat themselves, because that happens a lot of the time as well. And we want to make sure we're using agents in the right way. There's a lot of AI technology that we need to now bring into this experience. So when do you use an agent? When do you use AI? That's really important as well. And ultimately, this allows us to ensure we have great outcomes for our customers, but also for our business customers, it means, we're streamlining processes, we're reducing calls. There's going to be cost efficiencies because of that.
Okay, Neil, going to come to you next. So a great example of where Connected Care has been successful is across our dental business. So can you talk to us about how patients and employers are benefiting from this?
I think there is a secret sauce around Connected Care, and that's about funding and provision together. What does that provide for our clients and for their employees? For me, it builds trust. And we've seen this in action over the last 10 or 11 years within our dental business through insurance and provision. And we've seen that from a client perspective, having that wraparound system means that they can come to us. If they've got an employee that's in trouble, that needs care, we can do everything we can to get them in and get them sorted out. But as we develop, we know that we've got to do more and more in this space. Now, we know that prevention is the key to health, not just oral health, but systemic health as well. And I'm really pleased that we've now introduced something called the All Included campaign. So regardless of your level of cover under your dental insurance, you're now fully covered for a new patient examination at any of our practices. And under many levels, you're also fully covered for your recall examinations and your hygienist appointments. And that's been really well received, as I've seen working in practice. And that's really been reflected in our NPS scores, which is now over 80 for our dental insurance customers.
Okay, Lucy, coming to you. So as we grow the number of customers using our in-house provision, how do we ensure we maintain great clinical outcomes and an unmatchable service?
So for dermatology, it's really tough to get a dermatology appointment in the UK. We've got skin analytics, fantastic in terms of avoiding the need to see a dermatologist if it's not necessary, but it's still necessary for a lot of customers. And we bought the dermatology partnership a year ago. And since we acquired that, we've now rolled out a dermatology pathway across 6 locations nationally. It guarantees our customers access to a face-to-face appointment within 10 days. We've also kind of thinking about mental health and the growth in mental health that we spoke about earlier. We've got clinical pathways there, and as we grow that, we're tracking the data and the evidence around what does that mean for our customers. And on average, if you go through our pathways into our kind of face-to-face services and our remote services, your customers will be better and kind of returning back to kind of where they want to be in 4 fewer sessions than at other providers. I think what's really fantastic about that is it's not just for our customers, that great outcomes and experience, but it also means that we're attracting really high quality clinicians who want to work with us, and we can't grow without having them as well. So the two go hand in hand.
Right, Charles, we're going to come to you now. How are we evolving the role of MyBupa to deliver more personalised and connected care?
I think a lot of this comes down to, personalization at its heart is about data. And I think if I look at Connected Care and the journey that we've been on there, it's really elevated the depth and the quality of the data that we actually have as part of that. I'd say the next step or evolution within that is how we start to think about sort of personalization. I really start to get excited about where My Bupa is going to go in the future. So we're going to be launching a health risk score for all of our customers in the next sort of 6 months. That's really focused on really understanding population level health insights around our customers. And that starts to give us the opportunity to engage with our customers in a whole breadth of different ways. And then I think that comes back to, being super customer centric in terms of what we're doing, but ultimately it comes down to those outcomes, those clinical outcomes that we can start to drive because we are being much more upstream in terms of that data. It allows us to be super personalized, but also then drive the right outcomes for our customers.